went through medical training when it was not nearly as expensive as it is today to become a physician, which will explain some of my comments about challenges when I get to that part of the talk. After I graduated from Ohio State, I had a number of options for where I wanted to go to do my residency training. At that time, by the time I had finished college, I realized I didn't want to be a dentist anymore because I didn't want to spend the rest of my time in somebody's mouth. I had interests that were a little bit more diverse than that. And when I thought about residency training, I really didn't like pediatrics because my patients couldn't give me histories, because I found parents incredibly difficult to deal with. I didn't like surgery because I trembled, and I trembled as far back as high school and college years, and it was relatively early that my surgical teachers told me that I'd have no business in an operating room. Plus, I never really enjoyed the preoperative or postoperative management of patients in the operating room. OBGYN was kind of interesting, but my wife was scared to death for a couple of reasons of me pursuing that career, in that one, the schedule is incredibly unpredictable, and two, for other inappropriate reasons that can lead to dirty jokes, which I'm not going to tell. And so I picked internal medicine, and the reason I picked internal medicine was because I liked the intellectual challenge. I often refer to myself, even to this day, to my patients as a medical Columbo. And if you don't know who Columbo is, you folks know who Columbo is. A medical detective. Always looking for clues, always trying to piece together a puzzle, looking for a little bit here, a little bit here, a little bit here, till you figure out what's wrong with the patient so you can do them the most good. And so I went to Akron City Hospital to do my medical residency, and I got one of these. And so I put it on. And all right, is anybody here a varsity athlete? Put on a uniform, right? And when you put on a uniform, you're still yourself. But now you're part of something bigger than you. And you have a responsibility not just to you, but to those who are on your team, but those who are counting on your team. So something's different when you put this on. And perhaps to my advantage or to my disadvantage, I consider that ever since I put on this coat, this defines who I am. Doesn't necessarily just define what I do, but it defines who I am. I've always been of the opinion that everybody works hard. Whether you're a pharmacist, whether you're flipping hamburgers, whether you're waiting tables, whether you're a mechanic, whether you're an engineer, whether you are whatever it is you do, everybody works hard if they're good at what they do and they care about what they do. But I have a number of friends that are in non-medical fields who've achieved tremendous success. They say, yeah, but when I make a mistake, patients don't die. And that's an incredible responsibility. And that doesn't go away when you take this coat off and hang it on your closet door when you go home at night. And that's a burden that doesn't get any easier to bear after doing it for 30 years. So when you're putting this coat on, expect to wear it every hour of the day for every day of your life until you stop doing what you do. Now, of course, as I've had my opportunity for transformation, I went from being in private practice. I still actively practice medicine, but now in a much larger group, but I'm still taking care of patients. Other folks will come out of medicine and maybe they go into the medical industry. I have a fellow that I did residency training with that's the medical director for a drug company. I know Mike Marvin and I were residents together. He practiced emergency medicine for 15 years and then went into occupational medicine. I have a friend of mine who's a nurse, who was a critical care nurse at Akron City Hospital, went on and got a master's degree in nursing and currently works for St. Jude's Medical, marketing cardiac devices. Pacemakers, defibrillators, coronary artery stents, and things like that. So there's always opportunity to take advantage of, but when you're doing what you're doing, there's nothing more important than what you're doing. Nothing. And that comes at a price, which I'll come to in a little bit. The other prop I brought with me is this. I remember when I was a medical student, I couldn't wait to get one of these. Pardon? Yes. Now, again, some of the older folks in the group may remember this commercial. I would imagine none of the students have seen it. I'm sorry? Yeah, it's a pager. The commercial, yeah, so I once went into a club, a bar, and I got this pager on my waist, and everybody in the bar, I'd never been in this place before, says, well, this guy must be either a doctor or a drug dealer because no one else wears pagers. And so we had a little conversation about that, but there was an old commercial by Corona Beer. And there's a palm tree on either side, and there's the ocean rolling in, and there's an arm that comes in from the side, picks up a stone, skips it out into the ocean, and they got this music playing and this little speech about Corona Beer, picks up another stone, skips it out into the ocean, and then you hear this beep, 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 and you see this little light flash on the table where the stones are, picks up the pager, skips it out into the ocean. And this goes along with, you know, you put this coat on and you have it on all the time. Even when I am not on call, I'm carrying this. Because you never know when the person who's covering for you gets sick or gets handed a pile of work that's much too big for him or her to handle, and you want to stay available to help to take care of those that are helping you to take care of patients who need you to take care of. My third prop is the stethoscope. They say it's becoming a tool of the past. When I was a medical intern and resident, you spent a lot of money on these things. This is about my fourth or fifth stethoscope in 30 years of practice. And everyone is getting a little bit lighter, and everyone is getting much less expensive, because what you find is it's not the price and the quality of the stethoscope that makes sense about what the stethoscope is hearing, it's what's between the earpieces. So that part of the reason they say that this may be obsolete is because technology has gotten so good that you see things and you hear things with testing and with imaging and with other things that you can never pick up with your hands or with a stethoscope. But what this allows you to do is this allows you to get really close to a patient and touch them in places where if you touched them in public, you would get arrested. And it's just another affirmation of this kind of incredible degree of trust and responsibility people who come to see you place in you. They come to you when they don't feel well. They come to you when they're vulnerable. They come to you when they're dying and they're hoping that you can do something for them. And when I picked my career of pulmonary medicine, a number of my other friends going into cardiology and gastroenterology said, well, why do you want to go into pulmonary disease? There's nothing you can do for patients with lung disease, and I couldn't believe that there was anything further from the truth. Because you can always do something for somebody. You can't always make them better, but you can always do something for them, whatever that might be. So after 3 years of medicine residency at Akron City Hospital, where I thought I was going to be a general internist, I decided that I hated going from my clinic room of headache to dysmenorrhea to diarrhea to diabetes to high blood pressure, because you have to be good at everything. And I also found out that it was incredibly frustrating to me when I would take a patient to the point of clinching their diagnosis and offering them definitive therapy, I had to pass them off to a specialist. And so when I thought about all the different specialty training I did during my residency, I came up with pulmonary medicine, because I can do an outpatient practice and I can maintain long-term relationships with people. I can continue to see those patients when they come into the hospital and they're sick. And when they get even sicker and they go to the intensive care unit and end up all wired up in tubes here and there and everywhere, I can still continue to provide care to them. And I can also do a variety of different diagnostic procedures that my tremor doesn't impede. And I'm an expert in something. And people call me up and they ask me for opinions. And I get sent patients who no one else has figured what their problem is. And you get this reaffirmation when you make a diagnosis and you prescribe a course of treatment and the patient comes back to see you a month later. And gosh, I can't believe how good I feel. So that's how I ended up in pulmonary medicine. And so after doing what I did for 20 years, in Akron, Ohio, I joined the Cleveland Clinic, and for a period of time I worked on the lung transplant committee, worked in the lung transplant clinic, and those folks were incredibly motivated and incredibly grateful, but there were also very few of them, and the huge majority of patients with lung disease aren't going to be candidates for lung transplantation. And so when the clinic offered me a position going back into general pulmonary practice and general critical care medicine, I leapt at the opportunity. So that's how I got to where I am today. If I look next at education, I've already applied some of this already. You can major in whatever you want to major in high school and or college. You just have to take enough stuff to fulfill the requirements for graduation and the requirements for your given field. I mean, obviously, if you're going to go into engineering or computer technology or information technology, you're going to want to concentrate on mathematics and science stuff. If you want to go into a medical field, you're going to want to take enough biology and chemistry to fulfill those requirements. Back when I was in medical school, and Mike would comment on this as well, the litmus test for college students in medical school was organic chemistry. Organic chemistry are the only 2 C's I have in my entire academic record. And I'm not sure, but I think that's probably why I got 10 rejection letters and only 1 acceptance to medical school. They were the only 2 C's on my son's academic medical record. Probably kept him out of medical school the first time he applied. My daughter got A's in both semesters of organic chemistry. She evidently is smarter than all of us. It's just an incredible volume of material. And the way that we registered at John Carroll, you registered in order based on how many credit hours you had and what your grade point average was. So when we're finishing our general chemistry class at the end of the freshman year, we're asking all the sophomores who just finished organic, who's the best teacher? So everybody mentions this Dr. Walsh fellow. So of course all the brightest students with the most credit hours sign up for Dr. Walsh's class. So we have 40 students in his class. And after the first 2 exams, he's got 22 A averages. And as he's passing out our 3rd test, he says, I want you to know, as he's walking around the room amongst us 40 students, I want you to know that there are 22 A averages in this class after the first 2 exams, and that will not stand. And the class average on the next exam was 50%, and then 55%, and then 60% on the last exam. And I think the only reason I managed to get a C in both of those semesters was I got B's on the final exam. So that, I guess the point of that story is, 1, it's an incredibly difficult course, and 2, that throughout your educational career you're going to run into some jerks. But you're going to learn from the jerks as much as you will learn from those that are a little easier to get along with. We had an attending physician at Akron City Hospital when Mike and I were residents, who's since died, God rest his soul. He was thrilled when the medical school called to his attention that one of his students rotating on his kidney service had written on his evaluation, Dr. Blank is relentlessly malignant. Now, I was interested in being a general internist. By that point, I was thinking I'm going to go into pulmonary disease and critical care medicine, but when I took my internal medicine boards, which basically test your ability to provide general internal medicine, medical care, my highest scores were not in pulmonary medicine or critical care medicine. My highest scores were in kidney disease, renal, and nephrology. So you've got to find a way to get beyond the crusty exterior of some of these folks and take what they have to offer to you. Because what I realized, 1, while I was training under this man, and secondly, when I had the privilege of practicing next to him for 10 to 15 years, is all he was trying to do was help you to realize your potential. And that's all any of us can hope to do, is help people to realize their potential. Career counseling, medical care, whatever it is. Help people live as good as they can and as well as they can for as long as they can. The medicine residency, family practice residency, pediatric residencies, depending on what you want to go into, are typically 3 years. Surgical residencies for general surgery, 5 years. When I was in training, everybody was going into specialties. Specialty training was anywhere from 2 to 3 years for medical subspecialties, 3 to 5 years for surgical subspecialties. There's been a big push in medical administration over the last year, and quite frankly in social policy, to direct people more towards primary care practice. And primary care practice today has changed. It was not unusual back when I went to training that internists or family practitioners would follow their patients into the hospital. When they were discharged, see them after they went home. It's very unusual today now for the same physician who's caring for a patient as the outpatient to continue to see them during the hospital. And that's driven by cost and efficiencies of care, and I think it's wrong. But it's the system that there is, and so you try to figure out a way to make it work the best you can for you. One of the most frustrating things of my medical training was by the time I had finished my specialty training, I was still looking, or by the time I finished my residency. You know, when you graduate from medical school and you look for your residency training, you sign up for a match. You interview a bunch of places, they put your name in a hat as to where they think you fit on their list. You put their names in a hat based on where you think they fit on your list. And then they throw all that into a computer and you match. And once you're graduating from medical school, that's a pretty exciting time. When you're finishing your medical residency and you apply to 12 fellowship programs for specialty training, and you list 6 of them on your application form, and you get the match letter on June 2nd, a year before you're finishing your medicine training, and you don't match at any of those programs, you're not very happy with that far into your career. Your choices are still left up to the whim of a computer. Now I ended up calling 3 places after the match came out and I hadn't matched. And part of the reason that I got, in addition to the 3 places I called, 3 additional phone calls, is I interviewed with a fellow by the name of Tom Petty, not of the Heartbreakers, but a big time pulmonary physician back in the early to mid '80s. And he was the director of the program at University of Colorado. At that time, probably the highest ranked pulmonary program in the entire country. And I started my morning with him, and during the course of that day, I interviewed with him, I interviewed with folks at the university, I interviewed with folks at Denver General Hospital, I interviewed with folks at National Jewish Center for Pulmonary Medicine, which today is still the #1 ranked pulmonary program in the entire USA. And at the end of the day, I had my final interview with Dr. Petty, and we're walking down the hallway from his office to his elevator. And on the walls, both sides of the hallway, 3 deep, 3 high, pictures of everyone who's ever trained. And he's saying, so-and-so is the director of pulmonary medicine at the Oxford Clinic in Louisiana, so-and-so is the director of pulmonary medicine at St. Louis, so-and-so is blah, 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 this and that. And I got to the end of the elevator, or end of the hallway with him, and I said to him, he says, do you have any other questions? I says, well, I just want to thank you for inviting me out. And he says, what do you mean? I says, well, you know, clearly you train incredibly high-quality people, and I'm totally impressed with your program. But I'm coming from a well-regarded, but still relatively small community hospital-based training program in the Midwest. And I think I may have wasted your time today. I fear I may have wasted your time today. And he looked at me square in the face, and he said, you know how many applications we get for 6 fellowship positions? I said, no. He says, 600 applications for 6 positions. He says, we cannot interview everyone who applies. So you've already been selected. So 1, you didn't waste my time. And 2, the other reason I'm showing you all of these people, and I'm telling you all of their names, is because when match day comes, if you don't match, or if their programs don't fill, all of these people that I've trained call me up. Who did you see that you didn't take that might be worthy of my consideration? And that's how I ended up with my fellowship position. So again, even when you perceive a failure, something good may come out of it. And for me it did. And I ended up in a very good training program. I never wanted to be a pulmonary academician. I wanted to be a clinician. I wanted to take care of patients. And if while I was taking care of patients I could provide education, that's what I wanted to do. So it worked out fine for me. So even when you're kicked in the gut or in the other places, and you don't know that you're ever going to recover, there's recovery. So keep that in mind too. So what do I like about what I do now? I've already told you I still get a big kick out of making a diagnosis that no one else has made. Someone who's been symptomatic for years, and within 15 minutes of talking to them, you know what the problem is, and you can stop the interview there, but you don't, because you want to hear the rest of their story. And then you tell them what testing you think you should do and why you should do it, what your alternatives might be and why. And then when you make that diagnosis and you prescribe therapy and they come back and they're feeling better. That is better than anything. Better than anything. I like when patients compliment me. Doctor, no one's ever taken an hour to listen to me. Well, that's part of the reason in our clinic we schedule an hour for a new patient. Is so that you have the opportunity to explore something that somebody else who scheduled a 10 or 15-minute visit might not have had the opportunity to explore. And I learned back when I was a high school student, actually. Our family doctor, I didn't think was a very good role model. He'd come into the room, his nurse had already taken all of our history. He would come into the room, he'd go to his little desk in the corner, he'd stand at this little desk, and he'd ask a couple of questions, and he'd scribble notes. And then he'd come over and he'd examine you for a couple of minutes. And then he'd go back to his desk and he'd scribble a couple of notes and he'd write a prescription, and on his way out the door he said, take this and call me if it doesn't get better. Never, I think it's this. This is the way I think this medicine's supposed to work. This might be the side effects. In 1996, in September, my father was dying in an intensive care unit, on a mechanical ventilator with a tube down his throat, unable to speak. Sedated, but alert enough that he knew we were there. Hands tied down to the edge of his bed so that he wouldn't accidentally or inadvertently pull tubes out of his mouth. And during that last 24 hours, his doctor visited me, my brother, my sister, and my mother 4 times in his last 24 hours. And I thought did an extraordinary job of communicating to us what was going on with my dad. As well, when I first arrived at the hospital that day, the physician taking care of him was somebody who I knew from our medical school faculty, walked me into the ICU, introduced me to all the nurses, said, this is Dr. Ulbrich, he's a colleague of mine, he's Mr. Ulbrich's son, he can look at anything he wants to look at. And I looked at my dad's admitting labs, and I knew he wasn't going home. And so every time the doctors would leave the room, my mother, brother, and sister, all of whom were college educated, 2 of whom were college graduates, would look at me and say, what did he just say? And so you try to translate it. And the last visit, which was about an hour and a half before Dad died, they looked at me and said, what did he just say? I said, Dad's not coming home. I mean, you have to communicate to people in words they're going to understand. Which is why I've chosen not to use a bunch of song references or literary references or movie references, which, again, you probably wouldn't recognize. I still have, looking down here at motivation, I still have every gift that has ever been given to me by a patient. Except for the ones that you could eat or drink. So, for me, and again, what motivates me? I was seeing a patient for the first time, and her first visit was between Christmas and Thanksgiving. And that's a time when a lot of folks are kind enough to bring in cookies and baked goods and things for the physicians and the staff who are taking care of them as a way to thank them. And so at the end of our visit, she says, I think I like you, but it's clear you don't need anything else to eat. What do you like to drink? I says, well, I've been known to have a glass of Jack Daniels now and then. So every Christmas for the next 10 years, this woman scheduled an appointment in my office in December and brought me a bottle of Jack Daniels. So when I took the job with the clinic, first time I met this elderly woman who I still see today, I'm telling her this story. And she says, do you still drink Jack Daniels? I says, well, no, I'm a little bit more of a vodka fan now. And so for the last 6 Christmases, this lady always schedules an appointment during December, and I get a bottle of Grey Goose vodka. And during the last 5 years, I was part of the transplant clinic. Just yesterday, I got an email from a patient because I had sent an email to them thanking them for the world's best cookies I have ever eaten. Combination of chocolate chip, peanut butter, and oatmeal, all in the same cookie. So she sends me this email, did the cookies arrive? And I said, yes, they did. I says, I have to tell you, though, they arrived after I left the clinic on Thursday for a meeting. And when I came in on Friday morning, they were half gone. Now, my staff told me that that's the way they arrive. By the end of that day, the rest of them were gone. Thank you so much for thinking of me. And so I've saved all of those things. And I also think the 2 other things that I like about what I do is I like when people are satisfied, and I like knowing that I made a difference for someone. Now, what did all that come at the price of? Well, I mentioned my father. He died when I was 40. That was the second of 3 crises that hit me during my 40th year. I turned 40, my father died, my marriage started to crumble. And my marriage started to crumble, and I separated from my first wife for the first time when I was 40 years old. And I think to this day, it's because when I went away to college, I put my nose to the grindstone. And I kept it there until I was 40. Which is why I started a little bit earlier with the point, work hard. Take pride in what you do, but find balance. I never found balance, not until after I turned 40. That marriage ended. As that marriage ended, we went through divorce counseling with my kids. My kids beat me up about how I was never around for things that they needed me to be around for. They seem to have forgotten me reading them bedtime stories. Of course, they remembered me falling asleep while I was reading them the stories and their mother finishing the story. They seem to have forgotten me teaching them how to ride bicycles. But that's what they remembered, and that's what they shared with the counselors during our divorce proceedings. And oddly enough, as critical as they were of the time demands that were put upon me by my medical career, they both decided to pursue a career in medicine. So I'm thinking I must have done something right with that. And I'm hoping that at some point or another that it'll come back. I'm almost finished. A quote and a story. This is a great quote. But the one that I like is the one I read, and I can't remember how long ago it was, and it's right down there at the very end of my talk under motivation. People may forget what you said. People may forget what you do, but people never forget how you make them feel. So today in medical careers, whether you're a nurse, whether you're a medical technologist, whether you're drawing blood, whether you're reading x-rays, whether you're a nurse practitioner, whether you're a device representative, you're serving people. McDonald's is a service industry. Landscaping is a service industry. Selling hot tubs is a service industry. If your patient isn't satisfied, their grade of your performance as to how you made them feel now directly affects your hospital's reimbursement, your reimbursement. So you have to make sure that you communicate to your patients in whatever part of medicine you pick, that they know how important you are to them. So I can't remember how long ago I heard this story. This philosophy professor, do I have about 5 more minutes? Sure. This philosophy professor comes into class on the first day of class. And he's got about a 5-gallon glass jar that he puts down on the table on his desk in the center of the room, and all the students are standing around. And he comes in, he's got a wheelbarrow, and he's got about a half a dozen to a dozen rocks. And he puts his wheelbarrow in, and he puts all these rocks into the jar. And he asks the class, he says, "Is the jar full?" And all the students look, he's trying to put more rocks in, and he can't get any more rocks in. And they say, "Yeah, it looks like it's full." And then he comes in, and he's got 2 buckets of gravel. And he takes a bucket of gravel and he dumps it in and whistles down between the rocks to fill the bottom of the jar. He takes a second bucket of gravel, he dumps it in, it whittles down through the rocks, and the jar is now full. And he asks the students, he says, "Is the jar full?" I said, "Man, you can't get any more gravel and it looks like it's full." And so he comes in with sand. And he's got a bag of sand. And he starts pouring the sand in. And the sand's trickling down between the rocks, and it's trickling down between all the gravel, and he gets a 40-pound bag of sand into the jar. Sand starts tumbling over the edge of the jar as he's continuing to pour. And he asks the students, "Is the jar full?" And they said, "Well, you can't fit anything else in it." And he says, "Well, you may still be mistaken." And he goes behind his desk, and he opens a drawer, and he takes out a couple of Budweisers, or Coca-Cola, or cups of coffee, or whatever the appropriate term is for this. And he opens up 2 cans of Bud, and he pours them in until they start to run over the edge of the jar. And the point of the story is the rocks are the things that you have to put in place in your life. that should always be there and should always be important. And those have to be set in first. Because if you put all the gravel in and you put all the sand in, it fills up the space for the basic core principles that are going to make you who you are and are going to help you to be successful in whatever you're going to do. So set the core first. Let the other stuff fill in around it. But never get so busy that you can't take time to have a couple of beers with your friends. And that's the end of my speech.